بسم الله الرحمن الرحيم. الحمد لله وحده والصلاة والسلام على من لا نبي بعده. أما بعد, Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Zakaria Guennoun, consultant in diagnostic radiology, currently practicing in Saudi Arabia. Let's begin with an almost real-life clinical scenario. 26-year-old female presenting with primary infertility. Her inability to conceive brought her to her gynecologist, who recommended an MRI of the pelvis to explore the pelvic organs. In fact, it's only after doing the exam that we discovered that the patient had also long-lasting amenorrhea. And what did we find in the MRI? The absence of a uterus, absence of the cervix, and absence of the upper two-thirds of her vagina. There were also two small multicystic structures in the iliac fossa of both sides, which were considered to be ovaries. A diagnosis of Mayer-Rokitansky-Kuster-Hauser syndrome was established. Simple, right? Okay, this is the twist. What if I told you that this female could be a male, and the distinction on MRI could be rather difficult? To understand this concept, we have to go way back to the beginning. Inside the mother's womb, at 7 weeks of gestational age, all fetuses have both the Mullerian duct system, which is the internal female reproductive organs, and Wolffian duct system, which is the internal male reproductive organs initially. Both systems are present in the same fetus. And if a fetus is to be a boy, androgens cause the Wolffian ducts to develop into the vas deferens, epididymis, and seminal vesicles, while suppressing the Mullerian ducts. But sometimes there is androgen resistance due to a mutated androgen receptor, allowing the Mullerian ducts to develop into fallopian tubes, cervix, and upper parts of the vagina, while the Wolffian ducts regress. This is called androgen insensitivity syndrome, which can be complete or partial, and the complete form will give a genetic boy having a 46XY karyotype, but with female external genitalia, shortened vagina, and absence of a uterus and fallopian tube. Does it remind you of anything else? Of course, it really resembles the Mayer-Rokitansky-Kuster-Hauser syndrome. And for these reasons, complete androgen insensitivity syndrome and Mayer-Rokitansky-Kuster-Hauser syndrome share common clinical and imaging features, such as female phenotype, vaginal hypoplasia, and primary amenorrhea, and absence of uterus and cervix. So how do we diagnose complete androgen insensitivity syndrome, especially if chromosome testing is not available or hasn't been done yet? In the case of complete androgen insensitivity syndrome, we will search for non-descended rudimentary testicular tissue in the lower abdomen or groin, especially along the course of the inguinal canals. Beware that these rudimentary testes have a potential malignant transformation in adulthood, and to further complicate the situation, they can undergo cystic changes in such a way that you could misdiagnose them as the follicles of an ovary. So next time that you encounter a supposedly female with the diagnosis of a Mayer-Rokitansky-Kuster-Hauser syndrome, keep in mind that the patient could be a male. And please refrain from telling any of this to the husband until chromosome testing is done, and even at this point, just avoid telling him anything.